In this video, we are going to be looking at the topic Fibroscan. I'm Sharon. I'm working as an associate professor at Triple College of Nursing. Following are the objectives that we'll be addressing in this video. Chronic liver disease is a global health problem. Hence, there is a need for fibrosis and steatosis assessment, that is, fatty liver. Liver biopsy has historically been the primary means to evaluate fibrosis and monitor disease progression, but it has significant limitations. In the realm of modern medicine, advancements in diagnostic technologies have paved the way for more accurate and patient-friendly approaches to assess various health conditions. One groundbreaking innovation in hepatology is the Fibroscan liver test. It is an alternative to painful liver biopsy. Fibroscan is said to be safe, quick, and accurate. Fibroscan, otherwise referred to as transient elastography, is a non-invasive imaging technique that measures liver stiffness, which indicates fibrosis or scarring, and controlled attenuation parameter, CAP, which indicates fat accumulation in the liver, otherwise referred to as steatosis. Principle and technology used in Fibroscan. Fibroscan uses ultrasound waves and low-frequency vibrations. A probe is placed over the liver over the intercostal space. Vibrations generate a shear wave that travels through the liver tissue, and the ultrasound measures the speed of wave propagation, indicating the stiffer the liver, the faster the wave. The results show liver stiffness, it is measured in kilopascals, that is kPa, and CAP score, which is addressed previously, it is measured in decibels per meter, that is dB per m. What are the indications of Fibroscan? Fibroscan is recommended for patients with chronic hepatitis B or C, alcoholic liver disease, non-alcoholic fatty liver disease, that is NAFLD, or NASH, that is non-alcoholic steatohepatitis, in autoimmune hepatitis, and for monitoring liver fibrosis, that is early detection, progression, or regression after treatment. Let's look at the contraindications. Absolute contraindications for Fibroscan are pregnancy, because the safety of vibrations or ultrasound waves are not fully established. The next one is implanted electronic devices, example pacemaker, defibrillator, infusion pumps. There is a chance for possible interference, though new studies suggest relative safety, still avoided in many centers. The relative contraindications or situations with limited accuracy include ascites. Here, the shear waves cannot travel through the fluid. Then, severe obesity, especially with central adiposity, the excess fat may prevent accurate wave transmission. Then, narrow intercostal spaces. It will allow for poor probe contact, and thereby there is a difficulty in measurement. In acute hepatitis or liver inflammation, may give false high stiffness readings. And in the case of congestive heart failure or hepatic condition, may falsely elevate the results. Let's look at the procedure. Here the patient lies on the back with the right arm raised, and the probe is placed over the right upper abdomen. About 10 valid measurements are taken. The test is painless and usually takes 5 to 10 minutes. No sedation or recovery time is required. In this slide, we see the inference or the fibrosis score after the Fibroscan. So we can see it for various diseases, and you can see the kPa range. What we need to understand here is F0 to F1, okay? That is a level which indicates normal, whereas F2 indicates moderate scarring of the liver, F3 indicates severe scarring, and F4 indicates cirrhosis. So we can see it on the basis of different conditions, such as alcohol-related disease, polystatic disease, hepatitis B, hepatitis C, and non-alcoholic fatty liver disease. And F0 to F1 is the same for everyone, that is 2 to 7 kPa. When it comes to moderate scarring, an alcohol-related disease is 7 to 11. Cholestatic disease, it is 7 to 9. Hepatitis B, 8 to 9. And also in C. And non-alcoholic fatty liver disease, it is 7.5 to 10 kPa. Moving over to F3, there is severe scarring. An alcohol-related disease is 11 to 19 kPa. Cholestatic disease, it's 9 to 17. And hepatitis B, it's 8 to 11. Hepatitis C, 9 to 14. And in NAFLD, it is 10 to 14 kPa. And the final one, that is F4, that is cirrhosis. Alcohol-related disease, it is more than or equal to 19 kPa. Cholestatic disease is more than or equal to 17 kPa. Hepatitis B is more than or equal to 18 kPa. Hepatitis C more than or equal to 14 kPa. Same applies to NAFLD. So moving over to the grading, normal score indicates no scarring or mild scarring. Moderate to severe score means the reversible changes in the liver and that lifestyle modifications and a healthy diet can help manage it, and patients may not be symptomatic. An advanced score, the patient is cirrhotic and is having advanced liver disease. The Fibroscan is that it is a non-invasive, painless, safe test. The results are very quick, within minutes, and it allows for quantitative measurement, that is the level of fibrosis, and it can be repeated for follow-up, and it reduces the need for liver biopsy in many cases. The limitations of Fibroscan. It is not accurate in severe obesity, ascites, acute hepatitis, and it does not detect microscopic changes, which are very much evident in a biopsy. Nurse, she plays a role in preparing the patient. That is, the patient has to fast for 2 to 3 hours if required, explain the procedure to reduce anxiety, assist during positioning, recording and monitoring the results, educate the patients about liver health, the lifestyle changes that need to be made, and follow-up care. In conclusion, Fibroscan is a revolutionary non-invasive tool in hepatology. It helps in early detection and monitoring of liver diseases. While it cannot completely replace biopsy, it greatly reduces the need for invasive procedures. Other references? Watching this video.